Welcome. So you're here for your cranial nerve examination. Yep. I'm Dr. Robertson, and you've been referred to see me by your doctor. Okay, yeah. Can I offer you something to drink, maybe? A glass of water? Yeah? Okay. This is for you. I'll put it here. So I've read you've bumped your head quite hard. And you've been feeling slightly off ever since. Yeah. Okay. And you've been experiencing headaches or dizziness? Slightly? Yeah. What's your name again? Okay. And your date of birth? Okay. Well, cranial nerves are located in the skull, and they emerge directly from your brains into your body without the spinal cords coming in between. Yeah. So they make a direct link to certain parts of your body. Right. So this examination will be done to make sure your cranial nerves are functioning properly and that everything is okay. First of all, I'm going to have an overall look at your appearance to see if everything's fine, or maybe there are some neurological problems. Okay. Yep. Okay. Well, you've got quite a big bump on your forehead, so well, it must have hurt. Yeah. Well, I'm going to check your olfactory nerve. That's basically your sense of smell. Did you notice a change in your sense of smell lately? No? Okay, well, to conduct this test, I've got a couple of bottles with essential oils in them, and all you have to do is close one nostril, your left one first, and I put this on your nose, and you have to identify the smell for me. Okay, so please close your left nostril. Take a whiff. Okay, that one was easy. Yeah, it's lavender. Great. Next off, close your right nostril for me. Take a whiff again. I'll open the bottle first. Perfect. And that's cinnamon. Very well. Now, would you like to try another one? Yeah, why not? Okay. Yeah. Okay. Perfect. That's peppermint. Great. Okay. Next off, I'm going to check your optic nerve. Did you notice any change in your eyesight lately? Maybe blurred vision or... Okay, I'm going to check your visual acuity, which basically means that you understand what you are seeing. And it's an easy test, and I will use my letters for this one. So if you can close your left eye like this. Yeah. Could you read this line for me? From left to right. Yeah. Perfect. Could you read out this line for me? Yep. Great. Now, could you please cover your other eye like this? Same way. Yep. And we're going to repeat this. If you can read this line for me from right to left. Yep. And read out this line for me from right to left. Okay. Perfect. And did you notice any change in your perception of colors lately? No? Okay. Next I'm going to test your field of vision. So I'm going to use my blue pen for this one. So I'm going to move my pen around, and as soon as you see my pen in your field of vision, you have to nod. Okay? Okay. So can you cover your left eye again for this? Yes. Okay, great. Okay, perfect. Okay, can you now close your other eye like this? Okay. Please nod if you see my pen appearing. Yep. Yes. Yes. Okay. Perfect. Next up, I'm going to examine your eyes to see if there are any abnormalities that could indicate any underlying disorders. Okay? Okay. So I'm going to open up your eyelids a little bit. Yep. Okay, that's perfectly fine. Great, thank you. Now I'm going to check your eyes using a light. So I'm going to shine a light in your eyes to determine if your pupils are responding correctly. Yep. I will use this light to do this test. And I will check your pupils directly and consensual. And consensual means that, for instance, if I shine this light in your left eye, your right eye pupil will react to this. Okay? So if you just sit still, I will shine this light in your eye like this. I'm going to check your pupil. Yep, and your other pupil is responding as well. And okay. Yeah, please focus on the light. Yeah, perfect. Great. Next I'm going to do the swinging light test. So I'm moving this light from left to right and from right to left, and all you have to do is keep your head still and follow the light with your eyes, okay? Great. Very well, thank you. Now, next off, could you follow my pen and from left to right, from right to left, up, down, and down, up, okay? Okay, just focus on my pen and please keep your head still, okay? Great. Could you close your left eye like this? I'm going to repeat this test again. Okay. Okay. Could you close your right eye again like this? Okay. Yeah. Okay. Great. Thank you. And did you notice any blurring or double vision? Maybe perhaps because of the light. Okay, that's great. Okay, next I'm going to check your facial muscles. I would like you to clench and unclench your jaw. So, like this. And I will be holding your jaw when you do this to examine your muscles. Okay. So clench and unclench. Clench and unclench. Yep. Clench, unclench, clench, unclench. Okay, great. Oh, you seem to have some strong muscles. Great. For the next test, I want you to please close your eyes as tight as you can, and I'm going to try very gently to open your eyelids, okay? So close your eyes like this. Yeah. Okay. Yeah. Perfect. Now could you try and raise your eyebrows like this and keep them like that while I'll try to push them down? Yep. Yep, like this. Yep, perfect. So next off, I'm going to ask you to puff up your cheeks, and I will try to push the air out of your cheeks. So like this, okay? Okay. Great, thank you. Okay. Next up, I'm going to check your sense of hearing. So I'm going to rustle my fingers in one ear while I whisper some numbers in the other ear. And all you have to do is repeat the numbers. Okay? Okay. Here we go. 11, 14, 7, 2. Okay, great. And the other ear. 5, 6, 17, 22. Okay, great. Okay. Next up, I'm going to check your gag reflex. So all you have to do is cough for me, like. Yep. Okay, great. That was a simple test. Could you now please open up your mouth up wide, and I will check if everything is symmetrical, if everything is in order. Yeah. Great. Okay, please open your mouth. Could you open it up a little wider? Yeah. Okay. Well, okay, that's fine. Your tongue seems to be in perfect health as well, which is very important. Could you please now shrug your shoulders like this, and I will be trying to push them down very gently, not too hard, okay? Okay, just... okay? Yeah. Perfect. Next up, people find this a bit awkward, but it's important to do this. Could you please stick out your tongue and move it from one side to the other and back? Okay. Could you repeat this? Okay, great. Well, I think we are done actually. I think you passed the test. Your cranial nerves seem to be in perfect health. I will contact your doctor about the results today, and you will hear from me soon. Okay, great. So, have a good trip back, and thank you for coming over. Okay. Have a pleasant day.